Are we live? Hello, everybody, and welcome to another promotion for Foundations of Orofacial Myofunctional Therapy. If you're here, you may be interested in learning more about Orofacial Myofunctional Therapy. So I am so excited to have you. We're going to have fun tonight. We're going to play bingo. So give me a minute until I open all of my screens up. Let's see, I have too many screens open. And let's see, we're gonna play bingo. I think that I can put that in the, hey guys, look at you. So many of you here. Please invite a friend over. I was getting myself some tea. And I have tons of stuff going on today. I have tons of links for promotion. As I was sitting here, hey Val. As I was sitting here, I said, you know what am I going to give away? What am I going to give away? So I picked several things, and I cannot wait to share that with you guys. Let me see if I can find out the link for the bingo. Okay. All right. What do I do for the bingo, Miss Amanda? I think that you have to do #foundations to be able, yeah, just right. Hey, so many of you, Yasmin, Tammy, Iris, is it Babby? Oi, there's some Brazilian speaking people here. Awesome. How many of you have taken a myofunctional therapy course? Lift your hand up, and I'm checking with Amanda how we're going to start this. Put the link in the chat. Okay, let me see if I can copy. All right, we're playing bingo, everybody. Let's see if this is gonna work. All right. Did you pick the words already? Let's make sure that this is gonna work. All right, if you guys click on that link. Val, let me know if it works for you if you click on that link. Okay, perfect. So that's what we're gonna do. I'm going to start the presentation, and you guys are gonna have your bingo cards that is gonna be generated by that little link I just put on there. And whoever does one line first, I need you guys just take a photo and send it to me. You can send it to me on social media, on my Instagram account, and we will review it. When someone has bingo, they put it in the chat and send a screenshot as proof. Okay, either to my email, text, or Instagram. That will work. I'll probably give you guys the email. All right, and then they put foundations. Is it #foundations or foundations in the comments to be entered for a free something? All right, and at the end, I'm also going to give away half price, the foundations course. You screenshot the card. Yes, screenshot the card, and you guys are going to use that card. Mind you, I don't know the words, okay, but I'm probably going to say them. Guys, it is so cold here right now. Okay, any comment with the word foundation? Yeah, so everybody entered the word foundation. I'm going to do a giveaway at the end of this. I'm going to do cups and t-shirts. I'm thinking as we go. We have some new cups. I also have a promotion that I'm going to do for tonight that you can get a t-shirt and a cup, and you get one free. So you buy two and you get one free. So you can do 2 cups, you can do 2 t-shirts. There you go, Yasmin, you're the first one. Write foundations on the comments, and you'll be entered. Let me ask, is it foundation or foundations, Amanda? Amanda's my social media. Okay, awesome. I'm so excited about this. Let me see if I have the link here for, really quickly, for the free t-shirt. Why did I do that with that? All right, it's right here. So if you guys are watching this on Instagram, you will probably have to go to Orofacial Professionals. Actually, I need to, I'm so used to doing that when I'm not talking. When I'm presenting and sharing things is a little bit harder, guys, so hang in there with me. Okay, I just need to share. Oh, perfect. I just need to share this on all of our airway circle groups. Okay, airway circle. Here we go. All right, so we have tons of free things and fun things tonight. At the end of this, I'm going to give away 1 or maybe 2. We'll see how many people get bingo. Half price foundations, and the link in the comments is for buy one get one on the Airway Circle store. There's also a Black Friday membership sale. There's tons of things, and there's a foundations. Actually, the biggest foundation discount I'm ever going to offer, and I have ever offered, is tonight. I'm never going to do this price again, and I've never done this price again. So, and now we have, look at that, the manual. Anyways, let's start with the presentation, guys. And then we'll talk about all the fun things at the end. So let me see how I'm going to do this. Present. And let's do full screen. Okay, hopefully it's going to work. Let's see. Present, share screen. Screen sharing to monitors. Let's see. Google Chrome allow. Here we go. Can you guys see my screen? Everybody. Can you guys see my screen? Yes, yes, yes. Awesome. Hi, Renata. Thanks for the info. I'm getting messages. Okay, the word is foundations. You guys are right. Yay! Awesome. All righty. Let's go through some, I think this is better right here. Myofunctional therapy case studies. Can I move my, oops, no. Let me see if I can move my screen. I don't think I can do that because this is not big. Okay, let me make this one big too. And yeah, I don't think I can move my screen. Is it on the side? It's gonna be in the way. Oh, here. Yes, I can move. It's just one. There's no 2 people. Why is 2 over there? Can you guys see 2? Okay. Save. Save new layout. He moved me back down. All right. So let's do this one. Perfect. Perfect. Myofunctional therapy case studies. Let's talk. Presentation really starts right now, guys. If you guys don't know me, my name is Renata Nami, like tsunami without the Sioux. I am a certified orofacial myologist, certified through the IAOM since 2018. I'm originally born and raised in Brazil, but guess what? I have been here in the United States now longer than I have lived in Brazil. So how crazy is that? And I just noticed that we have the beauty of breathing branding on here. We do not need to have any of that. Oh, the girl set it up the wrong way. Oh, here it is. All right, Airway Circle. Let's see, foundations. Look at that. No, it's going to be Airway Circle. Okay, I think we got it. Perfect, perfect, perfect. Sorry about that. All righty. I was born and raised in Brazil. I have 2 beautiful children, Benny and Zoe. And yes, I always say this over here. Both of them were born lip-tied and tongue-tied, had tons of pain breastfeeding. They are part of my why I'm here, why I do what I do, why I'm so passionate about this, and why I don't want anybody else to have to go through what I went through as a mother, as a first time, breastfeeding person, not knowing how to navigate these things, and also as a therapist. So when I started doing myofunctional therapy, I had also tons of challenges. There weren't a lot of people back then doing what I'm doing now, and we didn't really have the help and the guidance that we are able to offer to you guys now. So here we are. By the way, you guys know that I run and operate MyoMoves, which is an online only myofunctional therapy platform or therapy practice, online practice. And I was messaging my team today because we have this thing that we check how many countries we have seen patients in. And I've always said it's over 30 countries because that was the last time I counted. We counted at 39 or 40 countries today. However, my team said that they think it's close to 50 now, that I'm around 50. So how exciting that we are able to reach people in so many different countries. If I can do it, you can do it too. And the need is there. So every single time that you guys share any information about myofunctional therapy, you are helping so many more people in the world to find the help that they need. So keep sharing, keep talking about it. And you guys know Area Circle started 2021 because I had the need to connect providers to other providers and patients to the right providers. And I could not do that without all the help that I have for all the Area Circle members and everybody who helps get Area Circle's word out there. So thank you for all of you. Here we go. So let's start with case number 1. Let's say that we have a 12-year-old girl who has a short lingual frenum, dental malocclusion. And if any of you guys do not know anything that I'm saying, please let me know and I will break it down further. I am looking at the messages or the comments right now. Again, to be entered in the giveaway, make sure you write the word foundations if you're just joining us now. And grab your bingo cards. I put the bingo card in the link. Click on there. Somebody's going to be getting a half off foundations course. And if you've already taken foundations, I'm going to give you something else. So join in the fun. All right. So this child had a short lingual frenum, dental malocclusion. She's a mouth breather. She has mild OSA with an AHI of 4, no enlarged tonsils or adenoids. What would you do? So the question is, in a case like this, with no adenotonsillar hypertrophy, but established mouth breathing and mild OSA, what specific myofunctional therapy protocol would you apply step by step? Of course, I cannot give you guys a step by step exactly what I would do with this patient because as a new myofunctional therapist, maybe you are going to put something together to give you more of a guidance. So you can have an idea of what to look forward to. However, if you're a seasoned myofunctional therapist, you're never going to put a step-by-step plan early in the game because everybody is so unique. Everybody is different. You're not going to decide on your exercises and your treatment plan for the day until that patient is sitting right in front of you. What I usually recommend for our students that are just starting is to, yes, pick a few exercises that you would give to this patient and have them in front of you. But whenever you start treating them, if they have a really hard time doing those, then you have to have a plan B. It's very important to know which exercises you should give before you give certain exercises, because if somebody's having a hard time doing certain things, it's because you've skipped some steps. So very, very important for you to recognize what needs to be done before they can move that muscle, before they can do that, and go back on those early phase 1 exercises. I can't give too much away. This is so hard, not saying everything that I want to say. What exact exercises would you use for respiratory and swallowing re-education after frenuloplasty? These questions didn't come from me, by the way. This came from an ENT wanting to know exactly what we would do. After frenuloplasty, this question doesn't even make sense because we're going to be working on respiratory before. Swallowing, we are going to be working after frenuloplasty. But usually I like to do phase 1. So I have 3 main phases, phase 1, 2, and 3. Each phase is about 6 sessions long. Some people are going to fly through those sessions and get to the goals of each phase very fast. And some people are going to move a lot slower. So I like to keep my breathing exercises to about 6 sessions or so. So almost one whole phase, depending on the patient, depending on the exercise breathing wise that I'm giving them. But I like to work on the breathing for a long time and the same exercise for a long time, because you can't give somebody a breathing exercise 1 week, the next week you change. It's like they didn't even get used to that one. They didn't even work very much, The same thing with the exercises that you guys are treatment planning. Make sure that you don't just change. It's like if you go to the gym and you do like 2 pull-ups and then you do 5 squats and then you jump from one thing to the other. Like, it doesn't give you enough time. You should give us enough. And I understand why you wouldn't. But even if you did, would still be benefit to take your course. This is a one-time mention. Is that enough for mastery? Just saying. Thank you, Joanne. I'm not sure exactly what you were referring to in terms of the whole treatment plan. Oh, that I was talking about the phases. Yes. I know if I start giving too much, I'm just going to give you guys my whole protocol here. People who have taken my course understand what I'm saying. You just can't unsee it. Whenever you understand how we practice and why we get results so much faster than other people, things just make sense. It just clicks, So let's see. And I'm giving you some. So I'm giving you exercises for breathing. Usually I keep about 6 sessions or so. I don't work on chewing and swallowing until phase 3. Phase 2. So phase 1 is the foundational phase. That's whenever you do. See, I'm giving you everything. Oh my God. It's funny because I don't have anybody to complain to it. Nobody's going to yell at me but myself. Phase 1, foundational phase, whenever we work on awareness of tongue position, of breathing, and mobility, tongue mobility. So I'm going to do a bunch of those easy movement exercises. And it's important to understand that it's not necessarily about the exercise. It's not like you have this list of exercises for phase 1, list of exercises for phase 2, and list for phase 3. We do, however, you can use exercises from phase 2 and 3 on one. So the way that I split the phases is about prescription. So you have a specific prescription for phase 1, specific prescription for phase 2, and you can do the same exercise with different prescriptions, if that makes sense. If it doesn't, come learn with us. So exact exercises, usually I start with humming. I like the pipe ball. I use that a lot. And by the way, everybody uses the pipe ball wrong. If you are using this exercise, I'm just going to show you guys what is wrong, because I see everybody posting photos online. Oh gosh, I have so many of them. Posting photos online doing this exercise, and they are wrong. Actually, even the video that I posted recently of other people doing exercises, everybody was doing it wrong. And I was telling them as they were doing the exercises that it was wrong. But this is wrong. If you see anybody doing this exercise like this, it is wrong. That is not how you do this exercise. That is not how you do this exercise. This is not how you do this exercise. Can you guys see me well? Because I'm sharing my screen, so I'm not sure. Oh my gosh, I almost fell inside my tea. That is wrong. Anyways, there is a very specific way to do this exercise. This is wrong. There's so many wrong things, and people are just using it. So one question about these myofunctional therapy exercises is understanding why you're doing what you're doing. Why are you asking for the patient to do that exercise? And if you don't understand how the exercise is supposed to be done and why we do it that way, then it's like you're going to the gym and you're picking up weights and you're going into machines and you're doing them wrong. You know what I mean? Are you going to get a workout? Yep. However, are you contracting the muscles how they are supposed to be contracting and using them the right way, engaging them the right way? Maybe not. You know what I mean? It's like A personal trainer would walk by you and be like, what are they doing in that machine? That is not right. You know what I mean? So it's the same way. Okay. When and how to coordinate with the orthodontist to ensure the treatment is truly effective. Whew, this is a good one. So, of course, we only have one photo of this patient. We do not really know anything else about this patient. In order for us to better treat and plan this case, I would need to see this patient's CBCT. I need to look at their nose. Do they have enlarged adenoids, enlarged tonsils, a deviated septum, enlarged turbinates? I don't know. But what is going on inside their nose? Are they having a hard time breathing or not? It's saying they don't have enlarged tonsils and adenoids. First of all, I don't trust anybody that tells me that. I want to see it. Even if they come from the ENT and they said, no, their adenoids are fine. Did you sculpt them? Did you put a little camera inside their nose and look at them? Oh, no. Or they did. Okay, what is the percentage of obstruction? Like, how bad is it? Oh, it's mild. No, I want to know, out of the whole airway that you see in there with the camera, is it 50% blocked? Is it 60% blocked? Give me a number. I feel like asking the ENT to do that, it gives you and the mom, the parents, a better understanding of what we're looking at. Because if it's almost all the way blocked, right, 80% or so, and then it improves, then if it's 50%, it's easier to gauge, where you are and where you want to be. Is there even anything else that can be done for this patient? But I need to look at their nose, and then I need to look at their upper and their lower jaw. So right here, I can see that they, of course, have a very tight frenum. It's short. If you guys notice, most of the short frenum, they have this Eiffel Tower appearance. And the short not frenums. Somebody please correct me. All these short frena attach too close to the tip of the tongue. And then if they are short, they also attach the alveolar crest, which is behind your lower anterior teeth. Oh, you guys can't see me at all? I'm sorry. Yes, please keep messaging me, guys, so I can, let me take a drink of my tea. I started making this tea that I put a, oh, you guys can't see me. Okay, you can see me. I put a, what is this called? A cinnamon stick and a piece of ginger. I cut a bunch of ginger, put in my freezer. So every night I have, it's just a regular non-caffeine tea bag. But anyways, and some yummy stuff in there. Sometimes I get some mint leaves if I have them outside. Alrighty, so I am trusting the ENT here that this patient doesn't have any enlarged tonsils or adenoids. I'm looking at the lower teeth. They have braces. So I know that there's some type of expansion is already going on. So I will probably be okay doing myofunctional therapy first with this patient and going through with the tongue tie release. I love the question, though. How do you coordinate with the orthodontist to ensure the treatment is truly effective? It's so important for us to communicate with our other providers. I want to talk to the ENT to understand exactly what they saw. I want to talk to the orthodontist to understand exactly what appliances they're using, how they are using these appliances, how long is the patient going to have these in their mouth. I am a huge proponent of releasing the tongue tie before expansion. And I know a lot of people say to do it after. Why, Renata? Somebody asked me why. In your course, you go over what to look for in the CT scan. Yes, we do. We do. We explain. Guys over here who took foundations, we have a class inside. Now I think it's MyoCircle. For Kimi. Kimi, that used to work for Airy Circle before. She did a class of looking into the CBCT and explaining every single structure. You guys let me know if that was foundations or MyoCircle. Val, I think you just took foundations. I think it's on there also. But yes, we teach you guys how to look through the CT scan, CBCT, and understand what you're looking at. Yes, ask me why do I like to release the tongue first? Because if this is somebody who is already going to go through expansion, we know that it's coming. It's in my circle page is saying, let's see if there's somebody from Foundations here and they can let us know if that's on there. I love the perspective, releasing before expansion. I'm always considering inches best because it's a way faster improvement. The tongue tie release. If they're restricted like this photo, I need that thing to be released ASAP. Children. So a lot of people who get worse after the tongue tie release are usually adults, overweight, that have a huge tongue. See, I remember in Foundations, Courtney Saints in Foundations. So yes, we do. I get those classes mixed up. I don't even know anymore what's in each. So that it's so hard, y'all, teaching 2 different classes, an advanced one and a Foundations, because I just want to teach you guys everything that I know. And I know that some of it may go over your head, but you guys know how much I like to talk. All right. So if I get a patient who does not have enlarged tonsils and adenoids, who has mild OSA, who is a mouth breather, dental malocclusion, however, they are going through orthodontics, as you guys can see, but the short frenum, this is a patient that 100% I'm going to do some myo and get the tongue tie release ASAP. When they are that restricted, I'm not going to have to do many sessions, especially if they have kind of good tone. Now, if the same patient came to me and they had enlarged tonsils and adenoids, I would work on that, with the ENT first. Because I do believe that one of the biggest reasons why people get their tongue tie to reattach, I said that completely the wrong way. But one of the biggest risks for the tongue to reattach is nasal obstruction. So if they cannot breathe well through their nose, would you still release if they have moderate severe sleep apnea and narrow palate, or do you wait until minimum intermolar width? So I am actually not as worried about the width as I am worried about the AP. So you have this transverse measurement, which is your width, molar to molar, intermolar width, which is how much room the tongue has sideways to fit in your palate. To me, that doesn't matter as much as your AP deficiency, meaning how far back is your upper and your lower jaw. So this room here, if you don't have a lot of room here for the patient to bring their tongue forward, up and forward, to leave the airway, to get out of the airway, and you release the tongue and there's just not enough room in there, that's the tongue that's way more likely to fall back. Nobody has done bingo yet? You guys, am I not saying enough stuff? We did have a small section on CBCT and Foundations. Good. Okay. Yes, that's the one with Kimi, I think, right? She's wonderful. Bingo. All right, Julianne. Didn't you just take the class, Julianne? I'll give you some free stuff. Tell me if you already took the class. And is it did you get like a line or did you get the full? There's a module on imaging, Foundations, and MyoCircle. Okay, but great, we have them both. She just took the class. Okay, well, message me, take a photo of your card. I haven't even looked at my bingo card. You guys grab your bingo cards. You guys can type some of the words that you see on your bingo here to help other people out. Okay, so let's do the first 5 people who get the lines. I'll give you guys like free cups or free t-shirts. You guys can pick. And then who gets the whole card first will get half off for the course. Let's keep going, but keep an eye out in your cards. So great question. Would you release a patient if they have moderate or severe sleep apnea and a narrow palate? So usually what I do, if it's an adult, okay, for children, for me, 100% of the kids, no matter how much crowding they have, I'm releasing their tongue first. Usually, almost like 99% of the time. If it's an adult who has moderate or severe sleep apnea, narrow palate, and small intermolar width, if they have a lot of AP, if they're far enough forward, and on the x-ray, on the CBCT, I can see that there's enough room for the tongue to move. then I would say yes, as long as two things are in place. As long as one, they have their MARPE appointment scheduled. And it has to be a MARPE. I'm a huge proponent. You guys know that. And number two, they have to have a mandibular advancement device, a MAD, if they're not going to go through expansion, or if it's going to be a while before they go through expansion. So I always tell my patients that there's, of course, also a small possibility that it could get worse, especially if they have a low tongue. If they have a huge tongue, to me, that's more important than a narrow palate. If their tongue is just super big, that's when I say no. So I look at tongue volume, and nobody's talking about tongue volume. You guys write that down. Renata's talking about tongue volume. I look at that before I even look at the narrow palate. They can have a huge palate. And if they have huge tongue volume, I'm not doing it. I need to write that down somewhere. But yeah, so if they can get a mandibular advancement device that's going to bring the lower jaw forward with the tongue, and they really need a tongue tie release, then yes. But now if it's one of those grade 2 TRMR, big compensation, if they're not that restricted, oh my gosh, we have more bingo. If they're not that restricted, then I don't recommend doing it if they're not that restricted. Okay, so how many people have bingo? Let's see. Julianne is the first. Paige, I think I have bingo too. Take a photo of your card. If you guys have my cell phone number, just text me. If you have my Instagram, message me on there. Courtney Gross is number 3. I'm using my phone, so I couldn't multitask on it. I know it's so hard. Val, you're number 4, and Iris, you're number 5. Okay, Paula, I'll do 6, and you guys can either pick a free T-shirt or a free cup. Paula, we're gonna do 6. I had a patient that has done ortho 3 times because of relapse. Came to see me and has a grade 3 lip tie and grade 4 tongue tie, has severe sleep apnea. She does not want to do any surgical options anymore. She said if she does just normal braces that tip the teeth to make more tongue space, would it help? I told her that's not the best, but is so tired of surgical options. Sorry, thank you for a long one. No, please send me questions, y'all. Rachel, I'll also give you a free T-shirt or a cup, Rachel. Send me a message. For you guys, just either message me. You know what? Best thing to do is to email. If you guys can email, connect@aeriescircle.com, because then I don't have to do it. Ness, our assistant will do it, because I will forget, y'all. So let's answer Yasmin's question. And if you guys want to answer that, please write in the comments too. What do you think? I'd love to know what you guys think. So severe sleep apnea, had ortho 3 times. She always has a relapse. So my first question is, what does her nose look like? I would love to be able to see her nose. Number 1, because if she's relapsing, there's something big happening. There's something happening in there. So you should have, I really want to see her now so I can give a good advice. Yes, so look at her nose first. What kind of orthodontics she had done? I mean, 3 times ortho. I'm assuming none of those were surgical, meaning MARPE or SARPE. MARPE is not really surgical, y'all. You're awake next to a little kid getting braces. Does she have a huge tongue? If she has a huge tongue, 0 nasal obstruction, then tipping the teeth out, yes, but guess what? She's going to relapse again, because that's what they've done every single time. So that's what you have to tell your patient. Listen, you have already had this treatment done 3 times and it did not work. If you do it one more time this way, you're going to get the same result. So yes, we need to get your tongue tie release. We need to get your lip tie release. If she has enough room for them and her tongue is small, I would say yes, as long as she also does not have nasal obstruction. But now if she has a huge tongue, nasal obstruction, those need to be addressed. And if you really feel like she needs, I don't know what her molar to molar is, I don't know what her AP looks like, but I would really talk to her about the difference of MARPE versus all these other braces, Invisalign, and all the other appliances out there, to explain to her that if we want a different result, we need to have a different approach. Oh my goodness, there's more people getting bingo. I just want to give a free stuff to everybody. Okay, everybody is going to get it. Rachel, Tammy, Elizabeth, email connect@airwaycircle.com with your bingo card. And you will get a link for a free t-shirt or a free cup. You still have to pay for shipping, by the way, just so you guys know. Tongue is small, no nasal obstruction, but thank you for that. I will do that. And you can totally private message me, and I will give you, if you want to send me some photos of this patient, if she wants you to consult with me, I'll be happy to look. Guys, I'm not going to have time to go through everything. So here will be my questions for that patient. We already went through it. So before I even made a treatment plan, I want to know, what is the history? Why is she mouth breathing? So did she have any trauma to the nose, or any type of trauma that could cause her to be mouth breathing? Does she not? It says that her tonsils and adenoids are fine. I want to know, did she have previous adenotonsillectomy, or they're just not enlarged? Previous upper respiratory infections. I want to know, does she take any medication? Does she have any pets, or does she have any allergies? Does she have constipation, bad wetting? How is her nutrition? How is exercise? What is her palate width? So before I do anything, I'll be asking all of these questions. The best thing that you guys can do is ask questions. We have so many people in the live. Hey guys, please tell me if you've already taken one of our courses. I would love to know. There's 47 of you here right now, plus Instagram, and I'm not sure how many people are on there. She had metal braces twice. Third time was just Invisalign to close the ostomy that kept relapsing. So yes, if she has braces, she's doing the exact same thing 4 times. Tell her she's going to get the exact same result, and you agree with her that she should not do that. But remember, tell her MARPE is not surgical. It's going to be a different procedure that she hasn't had it yet, which is going to give her a different result. Everyone wants the magic wand, 100%, Donna. Thank you for that. They don't want to put in the work of doing Mayo. I get, wow, nobody ever explained this to me before. Followed 6 months later with, yeah, I think he referred me to her. Yes. No, please, Yasmin, you can ask more questions. Anne, hey, Anne. This is slightly beyond the scope of the course, but there can also be non-anatomical factors contributing to sleep apnea to consider. 100% is essential sleep apnea. We don't really know. Yes, not course to talk tonight. Anne is one of our mentors for foundations and myocircles. So say hi to Anne. She is our speechy. And we have mentors that are changing now throughout the cohort. So you guys may see some new faces. Oh, he's saying that they're having trouble stream on Instagram. Come on, Instagram. Alrighty, guys. What else? I'm not going to have time to go through all of them. What time is it? Nobody got a full card yet? Myofunctional therapy plan. So before therapy, I usually work on awareness and mobility, the ability to move around. Post-therapy, I'm going to work on more tongue mobility. Then I do tone and strength. Then I do chewing and swallowing. That's usually how I work. These are a few things that you can do to improve nasal breathing. So I like the clear spray, nasal propolis, just regular saline, the oxygen spray. There's a few more. Clear Life is what I'm using for my children now. Clear Life. And it was Liz, who's also a mentor on Aerie Circle. It's actually a new mentor. You guys don't know that yet, but she's going to be a mentor next year. But Liz recommended a Clear Life, and I've been using the tablets and the spray for my kids, and it's fantastic. Panaris is something used, recommended by several ENTs, and it's great for those people that have nosebleeds and things like that and just dryness in the nose. It's more of a moisturizer. You guys have to remember that if somebody has dry nose, and they live in a place where it's super cold and the air is super dry, that doing any type of saline nasal spray is going to dry them out even more. All right, another bingo. Tara, please write connect@airwaycircle.com and tell them you got a bingo so you get a free gift. I want you guys to guess, and some people have already seen this photo, how many sessions of myofunctional therapy do you think this is? And if you have not heard me speak before, even if you don't have bingo, you're also going to get a prize if you get it right. How many sessions? Caitlin, what word did I just say that made your bingo? I'm curious. Anybody, how many sessions of myofunctional therapy? Elizabeth is saying 5. Adina is saying 3. Paula is saying 2. Caitlin is saying 1. Bridget is saying 1. Paige is saying 1. Tammy is saying 6. 2. No. Oh, chewing was the word. Good. Donna is saying 3. The closest one was Caitlin and Paige. Sessions. How many sessions? 8. All right, nobody got it right. I wanted to give something else out. So these were 0 sessions of myofunctional therapy. I saw her on the first visit. Yes, each phase is about 6 sessions. But this patient right here, I saw her. She was like the first photo. She was like that the first time she sent me the photo. So I did a consultation, and then I did an assessment right after. When she came back for her first session, that's what she looked like the second photo. And I was like, hold on, we haven't even done a session yet. What happened? Myofunctional therapy starts the moment the patient makes an appointment, because we are already increasing their awareness. We are already recommending several things that are going to change the way that they are breathing, that are already going to change their tongue position. We are educating them way, way early. So just by doing nasal hygiene, by removing stuffed animals from her room, by working on tongue clicking, all of that, we already had this insane results. After this child had tonsils and adenoids out, tongue tie release, and it's crazy how her cognitive ability changed. She used to speak very, very slow, and I have a video of her speaking before, and then I have a video of her singing afterwards, like crazy. It's insane. Great job, Caitlin. But I think, Caitlin, you said it after I mentioned. I don't know. Yes, no sessions yet. And look at her bite, y'all. However, her bite, this is after several sessions. I think it's about 2 phases that I did here. I sent her on the first photo to go get orthodontics, and they were talking about a face mask to bring the maxilla forward. And then on the second photo, they're saying that she may not need it, which I still think she does, but I'm not an orthodontist. But she's going through ortho right now, so we're taking a break until she's done with ortho, and then she comes back. Very important for you to take breaks during myofunctional therapy. You guys know this famous little case. This is 4 sessions of myofunctional therapy. No other treatment has been done at this point. This is why documenting is so, so important. Slight autism, slight ADHD, taking a whole hour to fall asleep, taking melatonin every night, wetting the bed every night, and waking up throughout the night. Did I say that already? All of it gone within 4 sessions. No longer needs melatonin. He's falling asleep within minutes. He's no longer wetting the bed, and he's sleeping throughout the night. So his focus changed in school during therapy sessions. All of a sudden, the teachers are going like, what happened? Who is this child? You know? And the mom said, you found my little boy behind those tired eyes. So this is one of my favorite cases. Here are some myofunctional therapy exercises that you guys can do. I'm only going to be able to go through one case, y'all. I don't have time. So these are some tongue exercises that I do for frenectomy. So suction hold, puppy tongue, tongue up, cheek punches. Those are all great to do before. I'm not going to give all of those. Here is the importance of doing therapy before the release. So this is just 4 or 5 sessions. Maybe it was the first phase of myofunctional therapy before they had the release done. So the mobility has improved drastically. This is research showing that the transverse width of the maxilla can affect your airway collapsibility, meaning the more narrow you are, the more chances you have to have sleep apnea. And here's Zoe. This is how we measured molar to molar. She's wearing an ALF appliance. Her palate was so wide there. We need to expand her again. But because we used the ALF, she relapsed. That's how you measure. Here are some types of palatal expanders. I'm going to go through those in the course. Here's with the Invisalign expander. If you guys have seen that, the IPE, you can tell that the suture opened up in the middle. So pretty cool case, 16-year-old kid. Here are Zoe's appliances that she has had. Do you guys see how on this side she has a full buccal crossbite? She expanded more on one side versus the other. That's usually due to cranial strains that are not being addressed. Lots of things that we don't really talk about much. This is before expansion, and then the second photo is after RPE and after the ALF. Look how wide she was. She has lost some of that, unfortunately. All right, case number 2. However, I don't think we're going to have enough time for the cases. So I'm going to plan to do, that's what I'm going to do. I'm going to do another live. Let me see if I can see I cannot see the other screens. Oh, here, if I do this, yes, let's just go to the end. I'm going to schedule another live so I can do the other 2 cases. I'm just going to do 2 more nights, or I can do these other cases with you guys. But let's talk really quickly about Foundations. Foundations is an online myofunctional therapy course for dental hygienists, speech language pathologists, dentists, occupational therapists, and physical therapists or doctors. We follow what the IAOM says about who can practice myofunctional therapy. So you guys that take our course are all eligible to apply for certification through them. So it is a 12-week course. We meet once a week at 8 p.m. Eastern Standard Time. But 2 days, a Saturday and a Sunday, we meet for about 4 hours where we're going to practice on each other. Most of these online courses don't have time for you guys to actually practice what you're learning. So we make sure that happens. Yasmin says, so she relapsed because she wore ALF after the expansion. She relapsed because the ALF only moved teeth and it didn't move bone. Yes. What our students are saying. So these are just a couple. Oh, I forgot. I was going to show you guys. I have a bunch of screenshots of comments inside our group of people saying, thank you so much for this course. We're so excited we took this course. So usually I like to take screenshots of those and I can share them with you guys because it's so much easier to hear from somebody who has actually taken a course. And actually, if you are on the fence, if you want to learn more about the course, you are welcome to reach out to anybody who has taken any of our courses, and they will be happy to tell you guys what they think about it. And always try to talk to somebody who has taken more than one course. Of course, it's the first course. Usually, you're going to think that it was difficult. Any first course that you take, you get overwhelmed, usually. However, we offer way more support out of any other course out there. Anybody's close to getting the whole bingo, the whole card? And you guys didn't tell me in the comments yet, how many of you have taken a first myofunctional therapy course? How many of you have not taken any? You guys can just tell me the number. How many have you taken? So this course is about 60 hours. It is 40 hours of content and about 20 hours of live meetings. Here are the modules. So on the first module, we have Introduction to Orofacial Myofunctional Disorders. What are they? What is the history? Then we do a little review on head and neck anatomy. We talk about tongue muscles, cranial nerves. Lindsay, you haven't taken any yet? It was a great course, so much support. Thank you, Val. 2, Rachel. 1, Elizabeth, Adina, Iris. Taken 1, close to getting the card full. Good, Tara. You might be getting half off. Bobby hasn't taken any. So close with the card. You guys tell me which words I have to say. I might be seeing them soon. Very, very good. For those of you who have taken 2 or 3 courses, stay until the end because I'm going to share a code for MyoCircle, even though I believe that everybody needs to take foundations before they take MyoCircle because they complement each other and they complete each other. Okay, I'll try to say that word soon. I see that, Timmy. They complement each other so well. And there are so many people who have taken MyoCircle who went back and took foundations and they go, whoa, I wish I had that when I first started. It is so much more complete than anything else that you guys are going to see out there. None yet. All right. Well, can't wait to have you guys on this. And for those of you who have already taken a course, tell me what do you wish you had that you didn't have in your course? You don't have to say which course you took, but what is the one thing that you think was missing from it? So head and neck anatomy review. Then we're going to go through different assessment protocols. What are the protocols that are validated out there? Because everybody that teaches a course can give their own protocol, but which ones are actually validated? And then we have templates and intake forms for you guys to see. And this is something new with foundations now. We give you guys a list of links for every practice form that you need in your practice. So all of your intake forms, your marketing forms, including my card, brochures. I actually don't think I have my brochure, but everything that I take to promote Myo Moves, the referral form, you guys actually have the templates. All you do is just click on it, change the color, put your name on it, put your practice logo, and you're done. So the headache of having to do all of this stuff, you don't have to do it anymore. So TMJ was missing. TMJ is usually advanced. I wouldn't say that that should be in an intro course. Habits, we have habits, thumb sucking, pacifier, etc. Discussing cat will be beneficial. What is that? Oh, CTs. Yes, we do have that. Where do you email the bingo card? It's connect@airwaycircle.com. What did you get, Elizabeth? Different levels of breathing exercises for treatment plan, complex cases, and CT. You guys have to take this with a grain of salt. You know, most of these myofunctional therapy training courses out there, it's so much information. I mean, I don't know about you guys, but I felt extremely overwhelmed after my first one. I studied by myself for 2 whole years before I even took my first course. And then I took my first course and I'm like, okay, well, what do I do now? Because there was no guidance. There was no like step by step, this is what you do. I am here to hold your hand. I didn't have anybody to message, to ask questions. They were my instructors that I paid $3,000 for the course, you know? So it's really beneficial to have that community that can kind of hold your hand for a whole year. We stay with you guys for a year. Foundations was my first course. And although, like Renata said, there were times that it felt overwhelming and a lot of info, I ended the course feeling like I had the knowledge to start implementing and continue to learn. The support from the mentors and sharing of cases and patients amongst the cohort members is very valuable. Hands-on with someone like we had in hygiene school. So Christy, we have that. Of course, you're not in person. However, there are several guidelines in place to be able to graduate foundation. So you have to do an assessment on somebody. Very, very important. We have to work on each other. Yes, if you're not, can you imagine? Yes. Even hygiene now, I don't even think they have real patients anymore. I think it's just one of those, what is it called? Dexter? I don't even remember their names. But one of those fake mouths, and then you can graduate. Can you imagine your first patient ever? It's a real person. You'll be so scary. Very, very good. So then we talk about, let's see, the templates and intake forms, which you guys are going to have a list of those to use. And then we go through the guidance call, which now I'm calling them consultation again. I keep going back and forth. What do you guys think? Guidance call or consultation? And then the myofunctional therapy full evaluation. Sometimes I split it in 2, which is the clinical assessment and then the functional assessment. But if I do a really good guidance call / consultation, then I have enough time to do the clinical and the functional together. Because to me, the clinical assessment is part of the consultation, and we can discuss that a little bit more, break it down. Bingo workout. No way, Lindsay. Lindsay, didn't you take the course already? You like guidance call better? Lindsay, didn't you take the course already? You tell me. I might have to give you half off of MyoCircle. So myofunctional therapy full evaluation. So the clinical assessment, what do you see? What are you looking at? You don't really necessarily need the patient there to be right in front of you. You have not? All right, you got the course for half off, girl. Nice, nice, nice. Make sure that you email connect@airwaycircle.com. You guys keep letting me know, though, if you got the whole card for bingo. And then the functional assessment is you really need the patient in front of you. Those are how are things functioning. So how is breathing, how is chewing, how is swallowing, how is muscle movement, how is tongue mobility. Based on that's what the true myofunctional therapist can see. Clinical assessment, you kind of learn that on a CE course. However, we go very deep into it. But you learn how to recognize these things, right? You cannot unsee what you've seen. So the functional assessment is more that formal myofunctional therapy training. How are things working and what are you going to do with that information that you just said? Has she said, oh, I can't read that. I almost read it, Yasmin. No, I have not said. I said the last one, I think. All right, what else? So myofunctional therapy exercises. We have so many exercises. I think there's 75 exercises for you guys. All types of exercises with videos explaining how do you teach the patient to do them, why do you do them, which the why behind the exercises is MyoCircle. So if you guys really want to understand a little bit deeper, you have to go to that one. Tara, are you the second one? Tara, you have not taken a course yet, have you? Let's see. Yes, I have said some of those. I said rest for sure. Rest posture. Oh my goodness, I just said posture. Somebody else asked about that. How do you do the functional assessment? How do you virtual? Do you go over that? How do you do the functional assessment virtually? You mean in the course or with the patient? There you go. Tara, you've taken Christy Gatto's intro course. She is fantastic. I love Christy. Highly, highly, highly recommend her course. Even if you have taken 3 courses, please go take Christy again. I mean, also, her course is extremely valuable, guys. She goes deep into muscles. You really, really need to understand muscles. Come take our course, girl. Tara, you got ours half off. So I'm going to give 2 away because I'm feeling Christmassy. We did Christmas lights in my house today. I know it's super early. My daughter got out of the car and she screams at the guys putting the lights on. It's not even Thanksgiving. And they said, it's not my fault. Chrissy's course. She just posted an Airway Circle. Very good, Elizabeth. Those are great courses. If you guys go to Airway Circle Professionals, Christy just posted about her course there. Highly recommend it. So then we go through therapy sessions. I actually have several sessions that you guys can watch me taking patients. So have you, in any of your courses, you guys shadow your instructor? So this is shadowing. You guys are going to be able to see me, see patients. So they're just recordings of me seeing the patients. You guys can kind of see what I do. There are exercises there that are MyoCircle exercises that people are like, what is that? What you're doing, but they're really good sessions. Then we go through therapy recommendations, nasal hygiene, sleep hygiene, all these things that we recommend throughout therapy, reducing allergens, everything that's included in it's myofunctional therapy is not just exercises, guys. That is why you guys saw results on that little girl so quickly, because it's not just exercises. In the course, since you like to see them in person, but if they're in another country, different in photos. I don't understand that. Yasmin, you also got, oh my gosh, guys, I didn't realize so many of you was going to get a full card. Wait until the end. Hold on. So let's see what else. Therapy recommendations. That is part of myofunctional therapy. Starts on day 1. Treatment protocol. This is my treatment protocol. So phase 1, 2, and 3 are the main phases. There's also 4 and 5 that I talk about in the course. But I have a list of exercises and how and I separate into, so it's really easy for you to pick an exercise from here, pick one from here, pick one from here. So I don't give you a plan to follow in terms of do this first, this second, this third. I give you what is supposed to be done first, second, and third, and you choose. So there's critical thinking going on in this course that you don't usually see out there. Lots of critical thinking. Then we go a little bit deep on oral ties. Very important as a new myofunctional therapist to understand oral ties. And I think that there's more after that. There's not a sleep one. I think there's module 13. I got to go check. I'm pretty sure there's module 13 on sleep. So you get all of that for $26.99. However, we have 3 bonuses. The bonuses are not here. What are the bonuses? You get 1 free year of the Airway Circle membership, over 200 lectures already recorded. You get 100 brochures valued at over $100. 100 brochures to start your marketing. You can just staple, it's an Airway Circle brochure. You can just staple your card to it and start giving away to places where you're going to go do lunch and learns and promote your practice. And you get, I don't have the bonuses in front of me. I thought they were here. You get something else. I can't remember. Let's see. How long is the course? So the course will last around 12 weeks. This is the differential about this course. We offer 4 extra months of group mentorship. So we have 4 extra meetings. We finished Foundations 2.0 in October. And then we had our first meeting already November 4th. And so many of the girls there were telling us that they had already seen their first patients, or they had done, 2 and 4 evaluations, and everybody is moving in the right direction. I am going to be on top of y'all. I want to make sure that you don't just take a course and then you give up and you don't want to do this anymore. This is an investment. You guys, the book and a shirt. Yes, you get a bag of goodies, tons of good things coming your way. But it's on the website, the bonuses that we offer with this. There's 3 bonuses. But for 4 months, that's when questions start popping up. It's after you start opening your practice and seeing patients. So I wanted to make this a little bit more supportive. And you do have a whole year of the WhatsApp group. So for a whole year, you can ask questions, and we're going to be there to answer you guys. In the course, how we do virtual appointments, we're just going to see each other on Zoom. So you guys are going to have a partner, and you're going to do an evaluation on each other. All right, let's see what else. Time commitment. Each module ranges from 30 minutes to 4 hours. So make sure that you schedule your week properly, accordingly, so you have enough time. If you guys went to a university right now to do a certification course, and that course was 2 months long, 3 months long, you would have to study at nights and weekends for that course if you're still working all day. So expect this for this course. If you're working all day and you have other things going on, you're going to be studying at night and listening to these things on the weekends for 2 to 3 months, or 3 months, 12 weeks. It's not, you're not going to add this into what you're already doing if you're working full time. It's going to be extra. So make sure that you have the time to be able to put into this. How long do I have access to the content? Forever. You do not lose access ever. I have already taken an intro course. How is this one different? Will I benefit from foundations? I always say that everybody in this field holds a little piece of the puzzle. The advantage of this course is that we have the supportive community with extra meetings. So the 4 months and the 1 year. And you also be the longest and most comprehensive course you will find out there. Will I have access to supportive community? Yes. So I just mentioned that. Do you offer a payment plan? We do. We have a 3-month payment plan. It's on the questions on the bottom of the website. You guys can scroll down and make sure you click on that link you're going to get. But there's no discount for the installments because they charge us insane money to pay anything installments. Guys, get your phones out and take a photo of the class schedule. I don't think it's changed. Let's see. As of right now, this is our class schedule. It is tentative. There are here and there we have, to change it if emergency happens, but usually we'll follow this pretty good. So all the classes are Tuesday at 8 p.m. They usually last from 1 to 2 hours. I talk a lot at times, so make sure you guys set at least 2 hours aside. And then we're going to have 2 long classes that are about 4 hours each. One on February 7th, the other one on February 8th. And those start at 10 a.m. They're on Saturday and Sunday. There you go. So here is the QR code. Let me know if those QR codes are working. So I have never offered this big of a discount for foundations. Guys, it is the longest course of anyone out there with the most hour and the most support after the course is over, and it's the cheapest one. So with this discount, we already have a good number of people in the course, and we cut it after a certain amount, usually 20. I cut it off. So join us as soon as you can, because as soon as I get my 20 registrations, we are closing the doors. The other course, we got full before I even went to promote the course. Before I did this live, we were full. So jump in there, come hang out with us. This is super exciting. In 12 weeks, you guys can start practicing, you can start seeing patients. And remember that we're going to be there to hold your hand through this. Anybody who's interested in MyoCircle, I am offering the same discount for MyoCircle. MyoCircle starts August 1st. We already have people signed up for MyoCircle because, again, after 20, we close, and people are excited. It's only once a year that we're doing our courses now. So if you're interested in MyoCircle, I would love for you to take foundations first. And for anybody who's taking foundations, you actually get a way bigger discount. So don't do this one. But if you have taken like 2-3 courses, message me and I'll see if you guys are ready for MyoCircle. And then if you don't want any of those and you don't even know, you're just trying to get your feet wet, you're not ready for your first course yet, join our Aries Circle Thursday Night Lives, our membership. $175 off. This is our intro founding members value that we offered when we first started 4 years ago. This discount right here, it's our Black Friday discount for this year. It ends December 1st. There is no turn back. So if you're not a member yet and all you want to do is just watch our Thursday Night Lives that we have over 200 of them recorded, take a screenshot, Christy, of the screen. If you want me to go back on the QR codes, I will. But this, there's podcast snippets. If you guys don't know what podcast snippets, you're going to fall in love. They're fake podcast AI recordings of research. So you can listen to research and learn. You pretty much read and use research in 5 or 6 minutes of listening to a cool podcast. It's so cool. You guys are going to love it. Anyways, over 200 lectures already recorded. The code is Black Friday. It's good until 12/1. And even though you get an email every year saying your membership at $450 is about to renew, it's always going to be $275. So this is a forever, ever promo code for Black Friday. I don't do this ever, forever. So take advantage of it. Take a screenshot if you're on your phone and you can't see it. Here is MyoCircle and here is foundations. Any last questions? If anybody wants to, I don't know if anybody can, I can invite anybody over here on stage. But any questions about the course, any questions about myofunctional therapy, any questions about running your business, please, can you go back one? You want MyoCircle? This is foundations, $5.99 off. This is MyoCircle. Take a screenshot. You know what? I haven't checked to see if there's any questions on Instagram. Let me take a quick look on Instagrams. Let's see. There's people laughing at me. My friends were laughing at me teaching class. I'm getting messages. Okay, let's see. Oh, I can't see myself live. Oh, I think it cut off. It did say, yeah, that Instagram was having a hard time, so I don't think it played. I actually could not remember my password, so I had to go in on my own moves. It disconnected the stream. They currently disconnect streams after 1 hour. Huh? Okay. Not working. Remove my own moves. Alrighty, guys. Any questions? Did I do all of them that you wanted to see? Oops, it's over here. This is the Black Friday. Black Friday discount forever, ever. If you are a new member. Okay, you got it. Yes. Okay, if you guys have any other questions, please, for those who want stuff. Did I forget to give anything away? For those, yes. For those who won the one-line bingo, you get either a free t-shirt or a free cup. Email connect@airwaycircle.com. Ness will send you a link tomorrow for you to purchase from the store. For those two, but I think there were 3 of you who got a full bingo card. The first 2 are supposed to only be the first one get half off. Half off foundations. Can the other, but I said I was going to give to the first 2. The last one I think was Tara. No, Yasmin. I can't remember who the third one was. But if you guys can message me and if you can bring a friend, I'm going to let you guys do half off, the third one who got it. If you bring a friend, I'll let you do half off. Let's see what else. Yes, the code. I think I put it in the beginning. Let me stop sharing real quick, guys. The code for 1 free t-shirt if you get a cup, or 1 free cup if you get a t-shirt, or whatever you guys want to get. It's buy 1, get 1. How do I stop sharing, y'all? Remove. Okay, I'm back on the screen. Now I can close this. Am I sharing still? I'm not sharing, right? Okay, let me get the code real quick. I'm going to put in the comments right before I go. And seriously, if you guys have any questions about, here it is. Any questions? It's not going. Any questions about foundations, about MyoCircle, about Airway Circle, about a patient, about myofunctional therapy? If you need help with anything, please let me know. But I'm super excited to see who our cohort is. We're starting to put the boxes together. Very soon, they're going to start going out after Thanksgiving. But you guys get a huge box with a book and the manual. I didn't even show you guys the manual. Guys, nobody else has this manual. It is super professional. It is so big. It's so beautiful. The whole course is on here. The font is really big, so it's easy to read. You can make your notes here. You have your mentors there. You can make your notes. We have the assessment. Look at that, the Airway Circle has done. It is such an incredible piece of, not equipment, but that's going to help you in your journey. I wish that I had something like this. It's like a book to go back to. It is pretty incredible. And we have this on our Airway Circle store. But if you are taking our course, you get one for free. And at the end, we have more room for you guys to do notes. It is such a beautiful book. Seriously, you guys are going to love it. All the protocols are here that we talk about. It's insane. And it's super, super beautiful, super professional. So you get a manual at no charge when you join our foundations. Anyways, I hope you guys enjoyed tonight. I will look at 2 more dates. You guys tell me if you want it. Tell me if you're interested in me doing the others. Yeah, I can't wait for the next case review. Okay, so you guys want it. That was my question. I will look at some 2 other dates for me to do the other 2 case reviews with you guys. And I will see you then. Thank you for being here tonight. Bye-bye.